Let's move on to anti-hepatitis drugs. Now, the anti-hepatitis drugs, really the mainstay of therapy has been the interferon alpha agents. Now, interferon alpha seems to work in viral penetration, and by inhibiting viral penetration, you are inhibiting probably the first or second step in viral replication. Anti-hepatitis B drugs are suppressive, not curative, so we're not necessarily curing the patient of hepatitis B. Anti-hepatitis C drugs are targeted for viral eradication. And in fact, we have seen eradication in many patients. Let's talk about interferon alpha. Now, interferon alpha is a cytokine, and it acts through the Janus kinases. So Janus was a mythical Greek god. Actually, he was an Olympian who had 10 heads. And so we talk about Janus kinases as being those agents that seem to have a whole bunch of different faces to them. Now, the Janus kinases phosphorylate STAT. That stands for signal transducers and activators of transcription. So we call these JAK-STAT receptors, and you can see the JAK portion down at the bottom. Now, this causes an increased production of antiviral proteins. There's a specific activation of a ribonuclease that degrades the viral messenger RNA when you activate these agents. This promotes the formation of natural killer cells that destroy infected liver cells. So that's why interferon alpha is such an important component of our immune system. Now, intramuscular injections of interferon alpha are usually how we administer this medication. The formulations vary from time and place. Now, the absorption is relatively slow. It's given about 2 or 3 times per week. We do have something called pegylated forms that can be given once a week. Pegylated forms refers to encasing the interferon in certain types of almost micelles or liposomes. The elimination is through hydrolysis and proteolysis in the kidney. In terms of where we use these medications, they're most commonly used in chronic hepatitis B, but we have actually used it in hepatitis C as well, usually acute hepatitis C, and we often combine it with ribavirin. In less common uses, we've used it in Kaposi sarcoma in HIV patients. We've also used it in papillomatosis and genital warts as well, although that's actually much less commonly used. Now, I have another category here called others under anti-hepatitis drugs. It's actually quite a large category. Now, we already spoke about interferon alpha, so I'm not going to sort of go through it again. Now, the other drugs that we use with hepatitis includes the DNA polymerase agents, the nucleoside inhibitors, the broad-spectrum replication inhibitors, and another set of drugs that I just call miscellaneous. Let's take a look at the DNA polymerase inhibitors. The prototypical drug of the DNA polymerase inhibitors is adefovir. It inhibits DNA polymerase of hepatitis B virus, which results in chain termination, but it results in chain termination after incorporation of the virus into the cell. It has good oral bioavailability, and it's unaffected by foods. You can do dose reductions in renal dysfunction because it is excreted by the kidney. It works quite well against viruses that are resistant to lamivudine, which is another antiviral agent that I'll talk about. In fact, let's talk about lamivudine now. It's a nucleoside inhibitor, and if you recall, nucleoside inhibitors are working on that very important step of nucleic acid synthesis. It inhibits HIV reverse transcriptase. It's a very long-acting agent in hepatitis B infected cells compared to, say, its limited activity in HIV infected cells. It's often used as monotherapy in hepatitis B. It's relatively non-toxic, and it causes a rapid suppression of hepatitis V viruses. Other agents that are active against hepatitis include the broad-spectrum replication inhibitors. We also know this as ribavirin, and it's actually quite a well-known drug. It inhibits replication of a wide range of DNA and RNA. It affects influenza A and B. It affects parainfluenza and respiratory syncytial virus. It also is active against paramyxoviruses and hepatitis C, as well as HIV. In terms of the mechanisms of action, we're not entirely sure how this particular drug works. We believe that it acts directly on guanine triphosphate to somehow cause an inhibition and capping of the viral messenger RNA. It also blocks RNA-dependent polymerases, which is why we use it so often. Now, in terms of using this medication, remember that in order to improve its absorption, we actually want more acidity in the stomach. So we tend to tell patients to avoid antacids when you're taking ribavirin. It's eliminated by the kidney, so we have to enact dose reductions if there's renal failure. We often use it with interferon alpha in chronic hepatitis C. Remember that monotherapy with this particular agent is not very effective. In terms of toxicity, there's a dose-dependent hemolytic anemia that's associated with this drug, and it is contraindicated in pregnancy. Miscellaneous drugs used to treat hepatitis patients include the following. Now, we have nucleoside analogs that work against DNA polymerase. We have agents that are approved for lamivudine resistance. We have agents that inhibit RNA polymerase. This particular agent is quite active in hepatitis C virus, and we actually can achieve 95% cure rates when used in association with ribavirin. Boceprevir is also a protease inhibitor, and it's used with ribavirin as well.